We paid €113.15 for an emergency hospital visit, an MRI, blood work, X-ray, and an appointment with a specialist at the same night. Let me explain how French healthcare actually works. Hi everyone, and welcome back to Simple Life in the South of France. If you are new here, I'm Gabi, and I'm sharing how it's like raising a family and building a life here in France. Today I'm diving into a really practical topic, healthcare in France. It can feel confusing at first, but once you understand how the system works, from Carte Vitale to reimbursements to mutuelles, it actually makes a lot of sense. So let me break it down step by step. And if you want practical tips that also save you money, make sure you watch till the end. First, the French health system called Assurance Maladie. Almost everyone living here long-term is covered, whether through work or residence. It's funded through social charges and taxes. But it's not like a UK where everything is free at the point of use. Here, you either pay everything upfront and then get reimbursed later, or once you are fully set, you just pay a small part of the fee that is not covered by the state. So, you get access, but there is still a payment and reimbursement system in place. The most important thing in the French health system is your Carte Vitale. This little green card is what you present when you see a doctor, go to the pharmacy, or visit a hospital. You can apply for your Carte Vitale once you lived in France for 3 months with proof of stable residence, or straight away if you start working and paying into the system. It can take a little while to actually receive the card, as I'm sure you heard, French paperwork isn't famous for being fast. It took me 9 months to receive mine, and it took my husband 11 months to receive his. But whilst you are waiting, you are still covered as long as you have your social security number. In that case, you pay everything upfront and apply for reimbursement once you receive your Carte Vitale. And then once your Carte Vitale arrives, you can send off all necessary paperwork to CPAM, which is your local branch of Assurance Maladie. In my area, all we had to do was put our documents in an envelope and drop them into a designated letterbox at the CPAM office. No stressful conversation in French required. It was actually really easy. Here is a tip. If you want to apply for reimbursement later, you have to remember to ask your doctor to give you a form called feuille de soins, because you will need to send off that document to be able to claim reimbursement later. Without that form, you're not going to be able to claim anything back. This part confused me at first, but here how it works. The French government sets an official price for every medical act, called tarif de convention. That is treated as the 100% price, even if your doctor charges more. The state then reimburses a percentage of that official price, not the actual fee charged. On the top of that, there are fixed charges that never get reimbursed. If you want to see the list to know what exactly you would need to pay, I will include details about this at the end of the video. So in practical terms, in a real-life example, this is how it works. Let's say you visit a GP who charges the official price of €25. You get reimbursed by the state 70% of this, which is €17.50, minus the €1 contribution that you have to pay. So you actually get back €16.50. So your actual cost is €8.50. That is your out-of-pocket cost. However, if your doctor charges €30 instead of €25, you still only get reimbursed based on the official €25 price. That means that you can get back the same amount of money, €16.50, and pay €13.50 yourself. That is where a mutuelle comes in. A mutuelle is a top-up insurance that covers the amount that the state doesn't. Approximately 95% of people in France have one. A basic mutuelle covers the 30% of the cost that you have to pay that is not covered by the state. In the previous GP example, it would pay the €7.50, so you only pay the €1 fixed charge. Some mutuelles covers more, let's say 150 or 200% of the official rate. That is useful if you see a specialist or go to hospitals that charge above the basic tariff. When I first looked at the price list for the different levels of mutuelles, I got really confused because I saw that some mutuelles, like some levels, offer 150 or 200% payback, and I thought, how come? Why would they pay more than the price you pay? So I actually had to ring them up and ask about it, and that's how I understand the whole process. And that's how I understood that the government has a set price for every single medical act. So yeah, it's confusing first, but then once you understand, it makes complete sense. Anyways, many employer provides a mutual where they pay part of the premium of the price for yourself, the rest coming out of your wages. And if you are self-employed, then you choose a mutual for yourself. So if you are happy with doctors who charge the standard rate, a simple mutual is fine. But if you want to peace of mind for dental, optical or private specialists, then you may want to look at stronger coverage. So here how it feels in everyday life. At first, you pay the whole amount and then apply for reimbursement later. But once your Carte Vitale and Mutuelle are linked, a system called tier Payant applies. That means that you don't pay the full bill anymore. Assurance Maladie pays the doctor their 70% directly. Your mutual, if you have one, pays its shares directly. And you just have to pay the small leftover, usually a €1 contribution. For example, when we take our kids to the GP, we don't pay the whole fee anymore. At the moment, we still don't have mutual because my husband only just received his Carte Vitale, so we try to get one sorted now. But regardless, we only have to pay the 30% remaining cost and the €1 extra fees at the GP. I remember the very first time this happened. I went to the receptionist desk at the doctor office to pay the bill, and she said, that would be €10.50. And I looked at her and said, are you sure? And she just smiled and said, you are all set in a system, so your accounts are linked. You don't need to pay the whole fee anymore. And honestly, it was such a nice moment. That was the moment I realized how well the system actually works once you are all set and in the system. I now actually know that our GP charges a little bit more than the standard rate set by the government. But to be fair, I don't actually mind it because we have really good experience with our GP, so I don't mind paying that extra couple of euros for a great service. I have to add though that if you have an appointment with a private specialist, even if you are all set in a system with your Carte Vitale and Mutuelle, the private specialist still may ask you to pay the whole amount up front, and you will need to apply for reimbursement later. Medicines also follow the reimbursement system. Some are reimbursed at 100%, others at 65%, and others at 30%. And non-essential ones may not be covered at all. And just like at the doctor, if your Carte Vitale and Mutuelle are linked, reimbursement often happens immediately and automatically at the pharmacy. As a mom of two, I find the doctors here very helpful and very kind. But I find the system a little bit more complicated compared to the UK. In the UK, when my kids were due for a vaccination, I received a text message from my doctor to remind me of this, so I could book an appointment straight away, visit my doctor where they register the vaccination immediately. In France, first I have to remember that I need to take my kids for a vaccination. Then I need to phone my doctor to book an appointment so I could go there and get a prescription for a vaccination. I will then take that prescription to the pharmacy to actually have the vaccination, and I would take that vaccination home, put it in my fridge. Then I would need to ring the doctor office again, book another appointment with them, and take this vaccination with me where the doctor can actually register the vaccination. So I don't know, for me it seems a little complicated. And once I actually managed to turn up to an appointment for a vaccination with my GP without the actual vaccine. I remember sitting at the office and the doctor looked at me and said, okay, so let's do this. Where is the vaccine? And I remembered I left it at home in my fridge. It was so embarrassing. I had to leave and then rebook the appointment, and yeah, it was just silly, but I never made that mistake again. I'm sure you've heard mixed things about French healthcare. Some say it's excellent, some say it's at the verge of collapsing, especially at the rural areas where you can't get an appointment. I can only share our own personal experience in the area we live. But personally for us, booking an appointment with a doctor was never an issue. Every time I went to the GP and booked an appointment, they given us an appointment within a couple of days notice, and they were really, really good. I also managed to book an appointment with a gynecologist for a general smear test within 1 week. But to be fair, I have to say that was the only day that I could book an appointment within a week. The next appointment were like 3 months away, so I think I also got lucky. But regardless, I managed to book it within a week. On the other hand, when I tried to book an appointment with a dermatologist, my doctor told me that the waiting list for that approximately 1 year long. That was a bit of a shock for me, to be fair, because except for that, we had a really, really good experience with the doctors, the wait times, like organizing any appointments really. So I asked him if there is any way how I can speed that up, and he said I can book an appointment earlier than that with no problem, but I need to be willing to travel 3.5 or 4 hours. So at least there is an option for that. We also visited A&E once a few months ago, and that was at a time when we didn't even have our Carte Vitale yet, and we received an excellent care. We got to the hospital around 8 o'clock in the evening, and they did MRI, they did blood work, they did x-rays, lots of checks, and they even organized an appointment with an eye specialist for us in a different hospital for the same night at 2 a.m. And the specialist came in from home just for this appointment. And for the whole package, for all of these things, we paid 113 euros and 15 cents. And I think it's super, super reasonable. That was obviously without Mutuelle. For us as a family, the whole system has been reassuring, affordable, and very high quality. So once we have Mutuelle, I can also report back to you how that works. And unfortunately, my son has an underbite, so I believe some dental works will need to be done on him. So I can also report back to you on how that worked out for us. So here are the extras you should know. Number 1, Doctolib. This is an app and a website that lets you book medical appointments online. You can search by location, price, or even if the doctor speaks English. Super useful and very easy to use. When you choose a doctor's practice after arriving in France, check whether they charge the official government set rate, the tarif de convention. If they do, you will save some money compared to the one that charges above the official rate. Dental and optical costs are reimbursed much less by the state. A good Mutuelle really makes a difference here, especially for braces, crowns and glasses. If you need an emergency care, the emergency number is 15 for SAMU. Ambulances are covered, but there is a small €2 fixed charge per trip. In our experience, the operator spoke very good English, which was very useful in emergency. As I mentioned earlier in the video, there are fixed charges that never get reimbursed, and here is the list of all these charges. Participation forfaitaire, €1 per medical act. This is capped at €4 per day per doctor or €50 per year per person. People under 18 years old, pregnant women and people with certain long-term conditions are all exempt. Forfait hospitalier, this is €20 per day for hospital stays, usually covered by Mutuelle if you have one. And lastly, there is franchise médicale, which is 50 cents per box of medicine, 50 cents per paramedical act, €2 per ambulance or medical transport, and it's all capped at €50 per person per year. So that's the French health system in a nutshell. Apply for your Carte Vitale after 3 months or when you start work. The state reimburses about 70% of the official government set rates. You always pay the small fixed contribution yourself, and with the Mutuelle, plus the tiered Payant system, you often don't advance the cost at all. I hope this video helped if you are thinking about moving to France or if you are just curious about how healthcare works here. And let me know in the comments if you experience healthcare in France yourself. Was it good? Was it bad? I would love to hear your thoughts. And if you like this video, don't forget to give me a like and subscribe for more about life here in the south of France. But for now, au revoir!